Hi everyone, I want to talk to you about a worldwide problem called stroke. If anyone should ask, what is stroke all about? Stroke is a disease affecting the brain, and when it does, it affects its functions as well. As a result of impaired blood supply, either due to blockage, which is ischemia, or massive blood leakage from arterial burst, which is hemorrhage. It could be transient ischemic attack, or otherwise called a mild stroke. It is a mild one without loss of function, and the patient is expected to make complete recovery within 24 hours. It could be ischemic stroke when the arteries are blocked, obstructing blood supply to that part of the brain. And that accounts for about 80 to 85% of all stroke. It could be hemorrhagic when the arteries burst and bleed into the brain due to high blood pressure or aneurysm within the brain. That accounts for about 15 to 20% of all strokes. It could be cryptogenic stroke. That means the cause is unknown and is about one third of all ischemic strokes. What are the risk factors here? There's what we call patent foramen ovale. While everyone is still in the womb, there's what we call right and left atria, and there will be an opening between right and left atria while in the womb. That opening should close at birth. For those who have it, those who still retain the hole, it's not a serious problem, but it can serve as the opening for embolus from the heart to the brain. If you have watched my presentation on atrial fibrillation, I've explained in details how fibrillating atria will not pump enough blood, leading to stasis, and stasis will lead to coagulation and thrombus formation, and from there it can get to the other parts of the body, particularly the brain. So if that ovale is still patent, is still open, not closed after birth, then any thrombus along the heart valves, particularly between the two atria, and gets into the circulatory system and go to the brain. Patent foramen ovale could serve as a risk factor, congenital from childhood. Diabetes mellitus, for reasons that we are all familiar with because I've produced a kind of video and presentation on diabetes mellitus already, that it causes ischemia, coronary artery disease, and the list goes on. Hypertension. Hypertension could lead to both ischemic and hemorrhagic stroke, but mostly hemorrhagic stroke. Ischemic heart disease like myocardial infarction, valvular heart disease, and arrhythmias will all cause sources of troubles, including thrombus formation and subsequent thromboembolism going into the brain. Smoking will cause ischemia, as we've all known. Brain aneurysm caused by SHAME, which is smoking, for S, H for hypertension, A for adult polycystic kidney, M for Marfan, E for Ehlers-Danlos syndrome. These will all cause brain aneurysm, and from brain aneurysm it's possible there is hemorrhagic stroke. The older one becomes, the more the likelihood. And of course, more male, race is now becoming worldwide, and family history is a non-modifiable risk factor. Age is not modifiable as well, like gender and race. Increased lipid and obesity will all lead to heteromatous plaques that can eventually detach and form thromboembolic substances that will block the arteries. Primary prevention. The aim of all my presentations is to prevent anything we could prevent. So we need to address all modifiable and non-modifiable risk factors. Positive family history, yes, that is non-modifiable. The age is non-modifiable. The gender is non-modifiable. The race is non-modifiable. So if the non-modifiable risk factor is present like family history, then we can start changing the modifiable risk factors to delay the occurrence, and if the patient is lucky enough not to even have it at all. So if the family history of stroke is present, then stop smoking if you are still smoking, please. If you are boozing a lot, binge drinking, please cut it. Let there be good diet control. If you visit the clinic, they can give you referral and pamphlet on diet and referral to dietitian. Let's reduce this weight. Get more active. Decrease salt intake if there's positive family history of stroke. Secondary prevention. That is what we do when the diagnosis is already made or the trouble has already ensued. We have to handle all modifiable risk factors that have been identified in this patient who has come down with stroke. If the source of the stroke, particularly ischemic stroke, is cardiac in origin, we give anticoagulants like warfarin, factor 10 inhibitor like Xarelto, Pradaxa, and Eliquis. If it is non-cardiogenic, then we can use platelets. Ticagrelor, clopidogrel, and if it is aspirin sensitive, we give dipridamole, but you can give your aspirin as well. What are the types of strokes that anyone may have? Ischemic stroke or transient ischemic attack is about 80 to 85% of all strokes. Cardio in origin with embolus from atrial fibrillation to cerebral arteries. That's what mostly causes ischemic stroke. Atherosclerotic lacunar stroke or vasculitis. Western diets will favor ischemia and myocardial infarction, but ischemic stroke or myocardial infarction is now worldwide. Hypertension on its own will cause either ischemic stroke or hemorrhagic, but hemorrhagic could be caused by aneurysm, trauma, and hypertension. CT scan. When we want to do tests in stroke patient, we do CT scan. Non-contrast CT scan is done. Why? We want to rule out hemorrhage. We can do CT angiography and do neck Doppler ultrasonography to rule out any obstruction, clogs, thrombus along the carotid artery, because it could easily be embolized and then go to the brain to cause ischemia. EKG, to know what is going on in the heart. That may give a clue to acute coronary syndrome. And of course, it can reveal atrial fibrillation or any form of arrhythmia that may precipitate clots through which embolus will reach the brain. Magnetic resonance imaging will show all the blood vessels and all the tissues and perfusion and everything. Cerebral angiography for arterial occlusion, vasculitis, and you need to determine if end atherectomy is needed here or not. If occlusion is greater than 60%, then end atherectomy is required. Some literature will tell you 70%, some will say 55%. So anything greater than 60, the individual is qualified for end atherectomy. Laboratory, you do ESR protein C, factor V laden, C-reactive protein, and antiphospholipids to rule out autoimmune diseases here. Lipid, you want to know what LDL is, glucose, complete blood count, renal function test, and thyroid function test. If the individual is young and having cryptogenic stroke, then do what we call TTE, transthoracic echo, and transesophageal echo. Why? We want to know whether there's patent foramen over and whether there's any problem with the valve and whether thrombus are formed there. Also monitoring. That will allow you to rule out any arrhythmia, particularly atrial fibrillation and valvular heart disease. The next presentation will be on signs and symptoms and treatment. Please watch out. Thank you for watching my video. Please subscribe to my channel so that you can be getting the videos as soon as they are released. Thank you.